हेलो दोस्तों, मैं हूं स्मिता कुमार और आप देख रहे हैं आपका अपना हेल्थ केयर चैनल मेडिसर्कल। क्या आप जानते हैं एस्थमा बच्चों में पाई जाने वाली सबसे पुरानी आम बीमारी है। चौंकाने वाली बात यह है कि कोविड का एस्थमा के पेशेंट्स पे काफ़ी कम प्रकोप देखा गया है। साथ ही साथ बड़ों की तुलना में बच्चों में एस्थमा के केसेस ज़्यादा देखे गए हैं। बड़ों में जहां इसका प्रतिशत करीब 7.7 यानी 7.7% है, बच्चों में इसके केसेस 9.4% है। पुरुषों और महिलाओं की अगर बात की जाए तो पुरुषों की तुलना में महिलाओं में एस्थमा के केसेस ज़्यादा देखे जा रहे हैं। पुरुषों में जहां इसका प्रतिशत करीब 7% है, महिलाओं में एस्थमा के केसेस करीब 9.2 यानी 9.2% है। 3 मई 2021 की एक रिपोर्ट के अनुसार 2021 में एस्थमा से करीब 262 मिलियन लोग यानी 262 मिलियन लोगों को प्रभावित किया है, अफेक्ट किया है। एयर क्वालिटी हम सब के लिए बहुत मायने रखती है। एस्थमा पेशेंट्स के लिए एयर क्वालिटी और भी ज़्यादा इम्पॉर्टेंट हो जाती है। एयर क्वालिटी के खराब होने की वजह से एस्थमा पेशेंट्स को काफ़ी दिक्कतों का सामना करना पड़ता है। एयर क्वालिटी के खराब होने के कई कारण हो सकते हैं, जैसा कि पोल्यूशन और अर्बनाइजेशन। इसलिए यह जानना और भी ज़रूरी है कि डॉक्टर इस बारे में क्या राय रखते हैं। मेडिसर्कल आपके पास लेकर आता है सीधे राइट इन्फॉर्मेशन डॉक्टर्स और एक्सपर्ट्स की जुबानी। तो आइए डॉक्टर से ही जानते हैं कि वो क्या टिप्स है जिसे अपनाकर हम एस्थमा के अटैक से बच सकते हैं और एस्थमा को कंट्रोल कर सकते हैं। स्टे हेल्दी, स्टे ट्यून टू मेडिसर्कल।
Asthma is an inflammation and obstruction of the bronchial tubes, passage that allow air to enter and leave the lungs. During an asthma attack, muscles surrounding the bronchial tubes constricts, narrowing the air passage, making it difficult to breathe. The duration of the attack may vary depending upon the cause. At Medicircle, on the occasion of World Asthma Day, we are speaking to eminent pulmonologists, respiratory therapists, pediatricians to build awareness regarding respiratory related diseases and their available treatments. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Rajgopal Narasimhan. Dr. Narasimhan is an asthma and allergy specialist practicing at the Allergy, Asthma and Chest Center in Bangalore. He has been trained at the CMC Vellore. He is into practice since the year 2000. Please welcome Dr. Narasimhan to Medicircle. Hello, Dr. Narasimhan, how are you?
Hello.
I hope you're fine and things around you are okay in this COVID pandemic.
Yes. I hope everything is okay with you all.
Thank you so much. All perfect. Okay, so doctor, to begin with, what is an asthma attack?
See, whenever a patient who suffers from asthma has symptoms, most of the time, sometimes it gets very bad. And
Right.
suddenly it becomes so bad that they have to change the current treatment to escalate it to get relief. And that is what is called as an asthma attack or an exacerbation.
Okay.
That can be either an increase in the cough, increase in the sputum, or it can be breathing difficulty due to the breathlessness that they face due to the spasm.
Right. So, doctor, what are the tests to diagnose asthma, or how can we detect it?
At the outset, when the patient comes to the doctor or the hospital with the symptoms of cough, repeated chest congestion, and difficulty in breathing and doing normal or activities, then what we do is we take a proper history. History is very important in the diagnosis of asthma because there is usually a history of heredity. There might be some symptoms that they have suffered during childhood, and later on they would have been all right in between. And then again, the problem starts later at age. And this can be repetitive. And a very classical thing that happens is when a patient says that with change of season or in a particular kind of an environment, the patient gets these symptoms, which is very distressing. That leads us to a suspicion that it could be an asthma. And we do what is called as a lung function testing or spirometry. When we do spirometry, there are certain criteria by which we can make a diagnosis and find out that this airway obstruction, which is there, is probably easily responding to a bronchodilator. So that the reversibility is the factor which we take into consideration when we do this objective assessment of the airway by spirometry. That is the commonest thing. And because they are, most of this asthma that we see is due to an allergic origin, we can also do additional tests in the form of allergy testing to find out what the triggering or the allergenic factor is, and then go ahead from there.
Asking, after the diagnosis is done, what is the treatment of asthma?
Yeah, once the diagnosis of asthma is established, it is very important for certain things to be told to the patient. Most patients, when they come to the doctor, want a cure. Unfortunately, asthma is not curable, but it is essentially effectively treatable. So now we have to make this point very clear that alternative therapies like yoga, Ayurveda, and other things don't work, and those kind of things will not give cure. But it is essentially possible to effectively treat this condition where normal life can go on and with minimal medication, which will be a maintenance. So basically, it is correcting the present problem that the patient has and preventing future risk of problems that may come. So that is what we have to very clearly see. And what is that we try to achieve? There should be no symptoms. The symptoms should be minimal or absent. They should not have sudden worsening or attacks that we call. And then they should not have any difficulty in doing normal activities or even exercise activities of any kind, which a person which is age related can do. Medicines should not be producing any side effects. Medicines should be minimum. And relief should be maximum. And also important is that asthma affects the lower airways, but many people also have problems in the upper airways, that is the nose and structures around. Even that needs to be controlled well for effective asthma control. So essentially, asthma treatment is getting control, maintaining control, and reducing medicine to the lowest degree, which will keep the patient going well at all times.
Okay. So, doctor, how reliable are inhalers for treating attacks?
Let me tell you that asthma is a very common condition, and I emphasize that the medicine should be minimum. So to give minimum medication, which will cause minimal side effects, inhalers are the best form of management for asthma. Similarly, for the upper airway, the intranasal topically acting medicines like the nasal sprays, and for the lower airway, we have two sets of inhalers. One is the preventer one, which controls the disease and prevents the attacks from coming. And the other one is the relief. When the patient suffers an attack, we have to give something for rescue. And that is the rescue medication.
Because there are
inhalers are invariably the best form of treatment.
Because there are a lot of myths and people are very reluctant about using an inhaler. Even for their children, parents are worried that inhalers might become their habit and they might create some side effects. At a later stage, even after treating themselves, they might feel that this has become a habit of using inhalers. So is that true? Can you break the myths?
No, what happens is, for this, what I do is we educate the patients first, tell them what is possible to do. And if we do what we can do the right way, what are the benefits? What happens if you don't properly treat? And see, now they may land up in the hospital with a severe attack. They may even land up in the ICU. And sometimes even young lives are lost because of inadequate proper treatment. So if all this has been explained to the patient, there is a level of comfort. And we always tell them, see, look, this is not the same medication that you will have to take lifelong. In asthma, what happens is sometimes the patient is absolutely under good control with minimum medication for a reasonable length of time. It can be even stopped. The patient may be in the interval period be absolutely okay. Then we also advocate what the WHO says as a self-management plan. So we tell the patient how to look for symptoms, how
Right.
to see and recognize that things are going wrong. We teach them what is called as good self-management. And that strategy works. Most patients will then think, yes, I can take charge of myself. I
Right.
can feel better. And that is what gives the confidence. So there's a lot of communication that has to be done. We have to explain, spend time every time, and keep on emphasizing the need for continued medication.
Thank you so much, Dr. Narasimhan, for coming to our show, sharing your valuable time and insights with us. I
Yeah.
hope your information, your knowledge that you've imparted today to our viewers will really help them. Thank you so much.
Yeah.
It was a pleasure
I
having you
hope
on the
so.
show.
Thank you. Thank you very much.